Hi, Dr. Edwards. My name is Cornetta Mosley. I am a AUD PhD student at the University of Washington.
Hi, Cornetta. Pleasure to meet you.
Pleasure to meet you as well. And so I listened to your talk yesterday, and I just had a few follow-up questions.
Sure, great.
Would you mind answering?
Absolutely.
Okay.
Sure. I think audiologists have to adapt. Audiologists can continue to work with patients in the same way they have over the past 30 years, but I think that's fine. New technology comes along, and they are new tools for the audiologist to use to treat the patient. So self-fine-tuning, for example, with an iPhone, I think can be a terrific tool for the audiologist. Ideally, audiologists would like to follow their patients everywhere they go and make adjustments in their home and in the restaurant, but they can't do that. So allowing the patient to make those adjustments in those locations, I think, is a great tool for them to use. And if these tools can offload some of the work that they would normally do in the clinic, maybe they could see more patients, because we know the aging population is growing. The audiologist population is not. So somehow they're going to have to be able to improve the number of patients that they see, and these tools might facilitate that.
Yeah, so I definitely agree with the empowering your patient. I think that's very important.
Yeah. Well, whatever these tools are, they've got to be easy and quick. So, because again, the audiologist doesn't have a lot of time. So, and it's I think the research community's responsibility to develop these and validate them in a way that they will be useful for the audiologist in fitting the individual needs of the patient. Now, these tools could be things that are implemented at the clinic, but again, they could be tools that are given to the patient later on. Maybe before they do a visit, they have a method of testing superthreshold performances, capabilities. So you have a better understanding of, for example, what their noise tolerance is, or how well they're going to understand speech and noise, or a variety of other mechanisms that would allow the audiologist to better treat the individual needs of the patient that are not revealed by the audio.
So, do you think that we should just use some of the tools that we already have in place more often, or?
I think new tools will be developed and hopefully will be used by the audiologist. I think the onus is on the research community to prove the effectiveness of these tools to the practicing clinician. So just showing in a laboratory that there's benefit with a complicated speech test doesn't mean that the patient's going to experience benefit if the clinician uses these procedures in the real world. So we have to know that in a typical practice with the typical patient, patients are actually going to have better outcomes. They're going to be more satisfied with the care that they've received from the healthcare professional, and they'll be more satisfied with their hearing aids. They'll have fewer returns, less follow-up visits for the audiologist, and that's motivation for both the patient and the audiologist to take the extra effort to use these new diagnostics and outcome measures.
So lots of room for translational research.
Absolutely.